We performed this study because we've seen from a number of research papers that wearing shoes alters knee joint loading in people with knee osteoarthritis. However, it's not quite clear on which shoes result in greater loading or lower loading. So the purpose of this study was to develop a range of criteria to select shoes that were flat, flexible styles of shoes versus shoes that were more stable and supportive. Some preliminary research has shown us that when walking in specific types of flat, flexible shoes, the knee joint loading is lower compared to walking in stable, supportive shoes. But there were a couple of problems with some of these studies in that they chose a specific type of shoe, and often that shoe may not be available on the market. So we were hoping to develop a criteria that would enable clinicians to choose a flat, flexible shoe that would suit the patient. So in this study we compared 3 different types of flat flexible shoes versus 3 different types of stable supportive shoes and walking barefoot. So flat flexible shoes are shoes that generally have a lower heel height, they're lighter weight and they're much more flexible, versus a stable supportive shoe which often has characteristics that increase the stability of the shoe during walking, things like a firmer density on the inside of the shoe. They also have much less flexibility in the shoe, and generally they have a higher heel height as well. So we found that all 3 of our flat flexible shoes resulted in lower knee joint loading than when people were walking in the stable supportive shoes. We do know that walking barefoot actually has the lowest loading, and we found that when people put the shoes on, any change in loading was much lower in those flat flexible shoes. Well, the next phase of this project would be to validate these criteria. So we would hope to recruit a much larger sample of people with knee osteoarthritis, give half of the group a couple of pairs of the shoes that fit either the stable supportive category or the flat flexible category, allow them to wear those shoes for around about 6 months, and then we'll measure to see if pain or function changes over that period.